we're talking about mass casualty protocols, we're talking about several issues here. They are part of the pre-planned procedures that hospitals would implement when faced with a sudden influx of patients that, of course, exceed their normal capacity, such as during a natural disaster, hurricane, as we're mentioning here. The triage system, patients are rapidly assessed, categorized based on their severity of their condition and urgency of care needs. Certainly, when I was in Haiti, about 3 days after the earthquake in 2010, and I part of my medical responsibilities were to triage individuals fairly rapidly. Next is resource allocation. Staff, supplies, and space need to be redistributed to handle the surge in patients. A communication plan is so important. So clear channels are established for internal and external communication. Staff mobilization, also very important. Of course, when needed, additional personnel are called in so that roles ultimately may be reassigned. And of course, patient flow management is important. So procedures need to be in place for efficiently moving patients through the hospital system. So these are all the things that we would see when implemented during a natural disaster. One, activation. So the incident command system is going to be activated, and a designated leader does take charge of coordinating the response. As I said, then we move into triage. Patients are quickly assessed and designated to an area, usually outside the main emergency department, using things like a color-coded system or numerical system that will help prioritize care. Space utilization is important. So these are non-essential areas that are going to be converted to patient care spaces. For example, cafeterias or conference rooms could become treatment areas. Staff deployment. Personnel are reassigned based on need, and with non-clinical staff potentially taking on support roles, we all have to pitch in at that time. Supply management, right? Emergency caches of supplies are going to be accessed, and conservation measures for critical resources are implemented. External coordination, communication is established with other hospitals, emergency services, and health departments to coordinate patient distribution and resource sharing. Of course, you're going to have documentation, adaptation. I can't tell you, going back to my Haiti experience, how we documented. There's lots of pictures on the internet. They all went viral. If you look up American Hospital, Haiti, 2010, you'll see they were just scraps of paper. We had nothing. We had no EMR. Obviously, we responded. There was no electricity. There was no nothing. So we had scraps of paper, literally, that we just tore and then just taped onto people's bed, and we just wrote the essential of notes. And so documentation adaptation is important. Streamlined documentation processes are used to ensure essential information is recorded without slowing patient care. And going back to the Haiti example, that's actually what we did, was because we just, patient pregnant, these meds should not be utilized as a result of pregnancy, or broken femur, fractured femur, status post-op, pain meds, look out for infection. And that would just be the note. It would be very, very succinct, but it just got the information across and helped all the clinicians, all the healthcare workers know exactly what was happening with that patient. Certainly during Katrina, family reunification was incredibly important. And there were Katrina was 2010, so it was still before the days. I can't remember if apps were a thing. I don't think apps were quite a thing at that point. And the internet was still new-ish. So, no. Katrina's 2005. I'm sorry, 2005. Yeah, apps were definitely not a thing. But it was these big boards, family reunification. I think now, with apps being what they are, I think family reunification is definitely a lot easier. But certainly seeing the pain in people's eyes, of just trying to find their family was very difficult. People looking for their parents or their children. It was very hard to see that. So we were trying to be very creative by putting up very, very large boards of just allowing people just to scroll through, looking for family members or for loved ones. And then, of course, continuous reassessment. The situation is constantly monitored. Certainly we did that in the Astrodome. Protocols are adjusted as needed based on patient volume and available resources. And then recovery planning, even while managing the immediate crisis, plans are made for returning to, at some point, normal operation. So these are the sorts of things that we really need to think about. Power outages require reliance on backup generators. Communication disruptions happen. Staff may be personally affected by the disaster, impacting availability. I mean, staff still have family members. They still have homes that they're still concerned about. Of course, we're seeing this right now with IV fluids, but supply chain disruptions limit access to essential medical supplies. And then eventually, evacuation plans may need to be implemented if the hospital itself is compromised by the disaster. And certainly we saw that during Hurricane Katrina.